High burnout and self-care in the psychology profession. Caring professionals are at the highest prevalence for burnout, since listening to other people's problems is often weary and taxing on a counselor or psychologist's mental health. Christina Maslach conducted burnout research in the 1970s and found that burnout had a three-dimensional effect involving exhaustion, which leads to a loss of capacity and subsequently ineffectiveness. Exhaustion encompasses stress, being anxious and overwhelmed, which then affects capacity in being able to attend to, process emotions, remember, and problem solve. Symptoms of burnout include having sexual impulses, emotional displays unusual for individuals, feeling of failure, and aggressive feelings. This often leads to decreased pleasure, persistence, pride in work, self-esteem, meaninglessness, less energy, less effort, and declining job engagement. Being a self-protective mechanism, cynicism is defined as increased callousness, which leads to client depersonalization. As a result, it produces emotional and cognitive distancing. This is an immediate reaction to exhaustion that has a cumulative effect. Situational factors include working conditions such as whether there is enough supervisory, physical, and social resources, a risk of overload, a type of occupation, and the nature of the employer. It is important to consider if one's own values do not align with the employer's. Mismatch theory is the mismatch between what individuals need and the employer's demands, which leads quickly to burnout. Often management is oblivious to the needs of their employers, hence exacerbating the risk of burnout. Maslach et al. 2000 proposed that situational factors depended heavily on workload, control, rewards, community, fairness, and values. Workload includes type and amount. Control involves having enough decisions and resources, and rewards involve social, intrinsic, and financial fulfillments. Demographics for burnout usually involve younger professionals, less than 30 years of age, who are more likely at risk, and as well as being unmarried and single. Gender is not a factor. Education was correlated with greater burnout, since higher educated individuals tend to pursue higher cognitively or emotionally demanding jobs. Individuals who have neuroticism, who are self-conscious, vulnerable, susceptible to vulnerability, have trait anxiety, depression, and are emotionally unstable, are more at risk. That's because neurotic people are more empathetic and more emotional. Other personality characteristics that increase burnout risk include having low self-esteem, being more stress-prone, having low hardiness, having an external locus of control, and being a perfectionist or having high conscientiousness. And according to Jungian typologies, these individuals have a feeling rather than thinking classification. To combat burnout, jobs need to be seen as meaningful and must be engaging, allowing for the development of resilience, enthusiasm, inspiration, and immersion. Usually, organizations expect individuals to change, but many times the problem is structural, and thus organizations should change to promote work-life balance, advocate for fair workload, syncing of values, community, and control, and must actively promote well-being. Psychologists combat burnout by having a learning plan known as the Continuing Professional Development, CPD. Every registered psychologist must complete 30 hours of the CPD every year. CPDs require critical reflections of own practices and goal setting, presented in logbook documentation, which is required by the registration board. They need a minimum of 10 hours of peer consultation every year, which can only be claimed relating to their own individual specialty, issue, or concern. Peer consultation involves talking to another psychologist, similar level or senior psychologist, to discuss about each other's issues, usually manifesting in a schedule of 2 hours of professional development and 1 hour peer consultation. They are person-to-person, which includes being face-to-face or via telephone or Skype. They allow for talking about ethical issues. Psychologists need to plan their work life, and peer consultation can be either in individual or group format for professional development. There are different types of CPDs, which can include writing, reading, analyzing, or assessing, and they need to be logged in. It involves attending to workshops, lectures, course studies, and seminars. Active CPDs are not mandatory, but psychologists are recommended to fulfill 10 hours of active training in the form of oral or written activities that help test learning. They involve the aforementioned seminars as well as oral presentations, providing peer consultation and role-playing. In order to maintain endorsement in certain areas of practice, 15 to 30 hours of CPD must be within the endorsed area of practice, and if endorsed in 2 areas, 15 hours for each area are required. CPD activities need to be relevant to psychologists' specialty. CPD portfolios need to document professional development and have a learning plan. There are also random audits that take place annually, and registration is renewed every November, needing to declare the 30 hours and 10 hours of peer supervision done in the previous 12 months. Punishments for not completing the CPD include refusing registration, examination of professional assessment, disciplinary proceedings, and registration being contingent on specific CPD activities. CPDs help maintain level of professional competence, self-efficacy, and failure was linked to lower professional standards and higher risk of burnout. Thus, self-care is important for psychologists and counselors, since it is the very thing that we aim to help others in, and helps build the counselor-client relationship that is dependent on trust. Our own mental health needs to be guaranteed, and that would reflect in our own skills, empathy, communication, knowledge, and ability to problem solve. In summary, we looked at high burnout prevalence in caring professionals. We looked at Christina Maslech's research in the 3 dimensions of burnout, such as exhaustion, loss of capacity, and ineffectiveness. We looked at symptoms of burnout, cynicism, situational factors, mismatch theory, demographics. We also looked at ways to combat burnout, including continuing professional development or CPDs, and peer consultation. There are different types of CPDs, such as active CPDs, and we also look at punishments for not fulfilling the required CPDs. Thanks for watching.